Thank you for your interest in Vet NeuroJar. Although we do our best to summarize veterinary articles, it does not supplement the actual article, and if you are able to download and review the article yourself, please see the link in the description. This video summarizes the article titled Phenotypic Characterization of Pomeranians with or without Chiari-like malformation and syringomyelia. To start with the introduction, Chiari-like malformation (CM) and syringomyelia (SM) are commonly diagnosed conditions in small and toy dog breeds such as the Cavalier King Charles Spaniel and Griffon Brooks Alois. Veterinary literature applies the term CM to a complex malformation of the skull, while SM is the buildup of fluid in a cavity in the spinal cord. Some use the term central canal dilation interchangeably to refer to a syrinx smaller than 2 mm in diameter. While there is still much to learn about the pathogenesis of these disorders, many clinical signs related to CM/SM have been described in literature. However, interpreting these signs as an indication of pain is subject to individual bias. The prevalence of CM and CKCS is nearly 100%, making it difficult to establish clinical signs without healthy controls within the breed. SM, on the other hand, has a varied prevalence in the CKCS, Griffon Brooks Alois, and other dog breeds. Reports have described clinical signs associated with SM dimensions and/or location and interpreted them as neuropathic pain signs. Although not specific to either of the conditions, these owner-reported clinical signs are essential for predicting whether an MRI procedure is necessary for dogs suspected of having CM/SM. Although Pomeranians have lesser documented cases of CM/SM in veterinary literature, it is understood that these dogs are also susceptible to the disorders. In a 2014 study, a Pomeranian owner with 8 dogs showed clinical signs suggestive of CM/SM, which were later confirmed in all 8 Pomeranians. In 2015, the Belgian and Dutch breed clubs called for Pomeranian screening by MRI to estimate the prevalence of CM/SM in this breed. This study aims to 1. Describe the phenotype of Pomeranians with or without CM/SM and 2. Evaluate differences and associations between CM/SM and ORCs or signalment factors. The hypotheses are that there are no statistically significant associations between classification of CM/SM and ORCs, quantitative syrinx measurements, and signalment and classification of CM and/or SM. For material and methods, from February 2015 to June 2023, Pomeranians were enrolled in a screening MRA study for CM/SM across multiple institutions, regardless of their pedigree or whether they had ORCs. All pet owners gave their informed consent to participate in this study, which recorded signalment factors such as the dog's sex, age, weight, country of origin, and pedigree. Historical data regarding the presence or absence of ORCs was collected through either owner consultation or online questionnaires, while MRA scans were performed under individualized anesthetic protocols. Low-field MRA scanners were used at the Renkliniek den Heuvel, Best, the Netherlands, and the Orion Clinic, Herentals, Belgium, while the Department of Clinical Sciences, Utrecht University, the Netherlands, and IVC Evidentia Referral Hospital Arnhem, the Netherlands, used high-field MRI scanners. The imaging software Radiant Dicam Viewer was utilized by the first author KS to measure the scans, which included sagittal T2W, sagittal T1W, and transverse T1W or T2W sequences of the craniocervicothoracic region, with the thoracic spinal cord up to at least the 4th thoracic vertebra included. Dogs with intracranial space-occupying lesions or vertebral canal space-occupying lesions were excluded from the study, as were MRA scans with artifacts or insufficient image quality for the purposes of accurate measurement and assessment. Evaluation showed that CM was present in dogs showing cerebellar herniation and impaction and with an unrounded shape of the cerebellum. SM was defined as a hyperintense intramedullary cavity along the central canal of the spinal cord, with SM0 classified as normal and SM1 and SM2 as abnormal. Quantitative measurements were taken on the presence of a syrinx, including maximum transverse syrinx width, spinal cord width estimates, maximum syrinx height, spinal cord height estimates on transverse images, maximum syrinx cross-sectional area, spinal cord cross-sectional area ratios on transverse images, maximum syrinx height, spinal cord height ratios on sagittal images, and length of the syrinx, C3 vertebral body length ratios. Additionally, it was noted where the syrinx was localized: cervical, thoracic, extensive, cervical and thoracic, continuous or multifocal, cervical and thoracic, discontinuous. Dogs were classified as with or without ORCs based on the presence or absence of specific signs reported by owners, as shown in Table 4. Table 1 summarizes dogs' classification according to their CM, SM, and ORCs. Different tests, including Mann-Whitney U test, Fisher's exact test, and chi-square test, were used to analyze the data and determine associations between the presence of ORCs and signalment factors. CM classification, SM localization, and quantitative syrinx measurements. Statistical data was analyzed using Microsoft Excel and RV4.3.1. The Pearson correlation coefficient was calculated to gather data about correlations between T2W-based and T1W-based measurements. The study ensures accurate measurements and classifications of CM/SM in Pomeranians, regardless of their pedigree or ORC status, which can help in analyzing and determining potential risk factors and further advancements in the prevention of CM/SM in dogs. Looking at the results, descriptive statistics, of the total 871 Pomeranians identified, 796 met the inclusion criteria for the study. These dogs originated from 22 different countries, with the majority, 69.9%, coming from either Russia, 38.2%, or the Netherlands, 31.7%. The origin of 114, 14.3%, dogs was unknown, and 531, 66.7%, dogs were purebred, while 265, 33.3%, were not. The male-to-female ratio was 0.98, 1.00. Median age of the dogs was 2.19 years, range 0.17 to 11.02. The body weight of 385 dogs, 48.4%, was available for analysis, and the median body weight was 3.3 kg, range 1.0 to 9.4. Prevalence of CM and SM. The prevalence of Chiari-like malformation CM was 54.9%, 437/796, while that of syringomyelia SM was 23.9%, 190/796. Multifocal localization of SM was found in 46.8% of dogs, while 40.5% had cervical localization, and 12.6% had extensive SM. In most cases of multifocal and extensive SM, the thoracic spinal cord was affected more severely than the cervical spinal cord, 52.8% and 66.7%, respectively. Classification of CM and SM and ORCs. Dogs classified as CM or SM abnormal, or both, had a greater likelihood of having obsessive and/or compulsive-like behaviors, ORCs, than dogs with no abnormalities. Dogs with only CM were 1.5 times more likely to have works than those with no abnormalities, while those with SM were 4.4 times more likely to have works than dogs with no abnormalities and 3.0 times more likely to have works than those with only CM abnormality. CM abnormal SM abnormal dogs were significantly more likely to have 5 specific works than normal dogs, which were phantom scratching, vocalization, spontaneous signs of pain, air licking, and scratching with skin contact, rubbing head or ears, or both. CM abnormal SM normal dogs were also more likely to have phantom scratching and scratching with skin contact, rubbing head or ears, or both than CM normal SM normal dogs. SM abnormal dogs were more likely to have phantom scratching, spontaneous signs of pain, vocalization, air licking, and scratching with skin contact, rubbing head or ears, or both than SM normal dogs. Pedigree, age, and body weight. Pomeranians from the Netherlands were 1.4 times more likely to be classified as CM abnormal than dogs from other countries combined. Dogs aged 1.5 years were 1.5 times more likely to be classified as CM abnormal than those aged 1.5 years, and CM abnormal dogs without a pedigree were 1.9 times more likely to have a CM2 classification than those with a pedigree. SM abnormal dogs were significantly older than SM normal dogs, with dogs aged 1.5 years being 3.2 times more likely to be classified as SM abnormal than those aged 1.5 years. Furthermore, dogs with a body weight of 2.5 kg were 6.3 times more likely to be classified as SM abnormal than those with a body weight of 2.5 kg. Quantitative syrinx measurements. T2W-based measurements were significantly larger than T1W-based measurements for all quantitative syrinx measurements, and all T2W-based and T1W-based measurements were strongly correlated. However, there were no significant differences in any syrinx measurements between SM abnormal dogs with ORCs and those without. Signalment and classification of CM and SM. There were no significant differences in CM-SM classification for dogs grouped according to sex or neuter status. For the discussion, this study is the first of its kind to evaluate Chiari-like malformation syringomyelia, CM-SM, in the Pomeranian breed. However, it is important to note that the included dogs were not sampled at random from the Pomeranian population, but were mainly informed through social media platforms and breed clubs. Therefore, the prevalence ranges for CM and SM reported in this study do not represent the true prevalence of these disorders in the Pomeranian population. Nonetheless, this study provides evidence that both disorders are prevalent in the Pomeranian breed. Moreover, the study shows that certain owner-reported clinical signs ORCs are associated with either CM or SM, such as phantom scratching and scratching with skin contact, rubbing head or ears, or both, which are associated with a CM abnormal classification. In contrast, phantom scratching, vocalization, head shaking, spontaneous signs of pain, and air licking are associated with an SM abnormal classification as part of their ORCs. An additive effect of having both CM and SM on the likelihood of owners reporting phantom scratching is also mentioned. However, it is important to note that ORCs may be related to other pathology, such as primary secretory otitis media. Some MRI is needed to differentiate between these conditions. The study also reports that age was significantly associated with CM as well as SM classification, and dogs aged 1.5 years were less likely to have CM-SM than dogs aged 1.5 years. In addition, smaller dogs had an increased risk of being affected by SM than larger dogs. While there was no association between body weight and CM classification, dogs with SM weighed significantly less than dogs without SM. These factors may be taken into account by breeders in selecting dogs less likely to give offspring with CM-SM. This study provides valuable information for veterinary clinicians and breeders in the assessment and management of CM-SM in Pomeranians. However, it is important to note that the diagnosis of CM-SM still necessitates diagnostic imaging MRI, and further studies are needed to fully understand the pathological mechanisms behind these disorders.